VNA Healthcare is a nonprofit corporation that's been providing care since 1901. The mission of VNA Healthcare is to meet the needs of the individuals in the communities we serve, whether that be home health, hospice, or their independent living needs. The goal of home care is really to help people stay at home and remain as independent as possible in their community where they want to be. There are two types of people who receive home care. The first are people that have something happen to them, an illness or an accident, and they need services for a short period of time so they can get back to where they were before. The second group, which really is getting larger and larger, are folks that are living with chronic illness and need some kind of help to maintain themselves in their home. And it could be that we're in there for years, or it could be that we come in and out depending on how they're feeling, but they're able to then stay in their house.
When I first joined the board of VNA Healthcare, one of the important things that I did was to go out on a home visit. One of the common threads in all our visits was that each of the patients really looked upon the clinician as someone that they welcomed in their home, and they didn't want the visit to end. And from my perspective, that was really a sign of the trust and the comfort that's immeasurable for the clients.
The fact that we've been delivering service for over 100 years really points to the fact that we have a product that is sustainable and really of value to the communities we serve.
People have a choice in what home care agency that they choose. The reason I would tell them to choose VNA Healthcare is because we're really their local agency. We do focus on the patient as the center of our care, and I believe we provide quality care.
VNA Healthcare provides a broad range of services to folks in the community. We have the traditional services that we started out with, which are the visiting nurse services. Nurses, therapists, social workers, and paraprofessionals that help people, usually when they come home from the hospital, get better. We have a large number of specialty programs geared at enhancing the care we can deliver to patients with different kinds of chronic illnesses. So we have telemonitoring programs. We have a diabetic specialist, we have a large wound care program, and we also have a respiratory therapist, which is really totally unique.
Well, the cardiac program at VNA Healthcare entails a piece of equipment called a telemonitor. Home health telemonitoring monitors their blood pressure, their heart rate, their oxygen, their weight, sometimes a single lead EKG, and also asks them a set of questions that are set up based on their diagnosis. So if they're a congestive heart failure patient, it'll ask them about increases in weight, difficulty breathing. This telemonitor is linked to the patient's telephone so that all those vital signs can be taken every day, and I can watch the patient. Okay, if someone has an abnormal reading, I will actually be flagged on the system, and I usually start by contacting the patient.
And she said, "Ruby, this is Mary Jane. How are we doing today?" And I say, "Well, I don't feel too good." And she tells me to do all my weight and everything and check everything first. And if she thinks something's wrong, then she'll tell you, "Call Dr. Ward."
The telemonitor helps because she does have a history of congestive heart failure. When the nurse goes into the patient's home, they normally go sometimes up to 3 times a week. When we put the telemonitor in place, it helps us enhance what the nurse can do by giving us daily readings that we've never had before.
You probably wouldn't expect a home care agency to have such a high level of technology, but we really do. We do a really good job of keeping people at home and not constantly in that revolving door of in and out of the hospital.
The telemonitor, it has really kept me home where I want to be and want to stay. Just knowing that someone is there for me every day and every night gives me good peace of mind.
The goal of the diabetes specialty program is to enable our patients to better manage their blood sugars over a short period of time. In doing that, we will promote their health and keep them out of the hospital.
I've had diabetes for 30 years. I went into the hospital because I had trouble breathing. I had cardiac arrest. I was away from my house for 9 months. Visiting nurses came in and helped.
Linda and I met when I was asked by her case manager to see her because of uncontrolled diabetes.
I was very surprised when Comalita showed me some of the things that I really didn't know about diabetes.
So that made me feel really good that I can really help somebody out there.
The day I came home was the happiest day of my life, I think. And every day I wake up and I thank God that I'm home, and they help make it possible.
The goal of physical therapy is basically to help a person restore their function, whether it's an endurance issue or whether they've lost their range of motion because they've had surgery or they have an increase in pain. Gino first came to me, he was referred to me by our nurse.
My nurse recommended physical therapy because it wasn't that easy for me to move around.
He was having a lot of difficulty doing really basic things like getting in and out of bed, getting in and out of the shower. We've been working on getting him to move, getting him to feel what normal movement is.
And the therapy has helped. It's only been 3 weeks, but even that has shown some improvement.
I really feel like I can make a difference in these people's lives, even if it's a small change, if it's as simple as helping someone like Gino get out of the chair. If it helps him stay home and live independently, then to me that's extremely rewarding.
The goal of hospice is to really support patients and families through the end-of-life process and offer them comfort and care in their homes. The HOPE team stands for Hospice Oncology Palliative Expertise. We have nurses, there's social work involved. We have a chaplain who's there for spiritual care. The home care aides and homemakers, all of us kind of have our own piece of the puzzle, and we all try to work together to have the best outcome for patients and families.
I've been through cancer 4 times, and on this last round, I said to my daughter, I don't want to go into a facility. I don't think I'm ready for it. I want to stay home.
Hospice is designed to help people optimize the quality of their life, however long that is. It's to help manage any symptoms that they have so they're comfortable, so they can enjoy their home, their family, whatever is important to them, and also to feel supported.
What surprised me was the freedom that I had. It definitely is centered on me, but it's in a companion way. It's not something that somebody's coming in and telling me and criticizing what to do. Here I am. I'm in my own home. I'm calling the shots. It's like friends coming to visit, only they're competent friends.
Independent living services help people remain at home by providing them with services that ensure that they're living at home safely and that they can live at home as long as possible in their own community.
That could be a homemaker who's going to prepare meals, do laundry, some food shopping. That can be a personal care worker, Meals on Wheels. Or it can be an emergency response unit that is really a lifeline for folks who live alone and need to know that somebody's out there for them.
Our personal care attendants provide personal care to our clients, such as assistance with bathing and dressing, as well as light housekeeping.
My client Mary, she's having a hard time getting around lately. If she didn't get this kind of help around the house, it would probably leave her in a very short situation.
If I didn't have Cindy come to the house, I just wouldn't be right. I would struggle.
The help that we VNA gives is helping her to stay in her home for a longer period of time. I know when I get old, I'm going to want to stay in my own home too.
I think she's wonderful because she does everything for me. I love her a lot.
I told you, we'll always stay together, Mary.
That's
we'll
right.
do it together, you know?
It's right.
Our Meals on Wheels service delivers up to 2 meals a day, providing those clients in the community with meals that perhaps they're unable to prepare themselves and that meet the nutritional requirements that they require in order to be healthy in their own home.
Our Meals on Wheels program has over 500 volunteers that are out there every day delivering meals. We could not do Meals on Wheels without them.
I've been delivering Meals on Wheels for the past 15 years. That's when I met Sharon.
Meals on Wheels is an important program because it gives an elderly senior citizen in the community, it keeps them their independence, where otherwise they would maybe have to move in with family and they wouldn't be able to stay on their own.
She brings me meals that I am not able to do myself.
More than half of the clients that receive the meals, I am probably the only person they see on a daily basis.
I can't wait for her to come here. She comes in the door, she brings in the meal, and we sit down and we talk for a while.
It's like everybody likes somebody to talk to. You know, it brightens their day. VNA Healthcare is probably one of the easiest companies to volunteer for. Their main concern is helping people, so what could be better? When I think about donors, I think about the importance of every dollar that comes into the agency, that without those continuing dollars, we wouldn't be able to provide the kind of care to other less fortunate people and families.
The way we use charitable funds is to be able to offer services that someone needs when they don't have insurance, and it can be for a variety of services. A young man in his early 30s came to us, and he had recently been laid off from his job and over time stopped paying his health insurance. Unfortunately, he received a terminal diagnosis and came to us needing hospice care. His family couldn't believe that he received all of the services without any payment, and they really were quite touched by the care we provided. It just goes to show that it isn't someone who's necessarily poor who needs free care. Anybody really can wind up without health insurance. That's why we need to continue to raise funds, because everybody deserves the opportunity to get well, and sometimes it just takes a little help from us in the end to make that happen. That's what we do, that's why we're here, and that's what makes VNA Healthcare special. The best care is coming home.
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 The best care is coming home. The best care is coming home.
The best care is coming home. And that's the truth.